For over 20 years, Dr. Jay Gerber has introduced the concepts of functional jaw orthopedics and neuromuscular occlusal treatment to thousands of dentists. Through his teaching and published works, he has earned a reputation as one of the world's leaders in modern occlusal concepts. His clinical efforts and innovative teaching techniques have benefited thousands of dentists and patients through stable occlusal finishing. To further his vision, Dr. Gerber has constructed a professional, state-of-the-art facility focused on the instruction and treatment of occlusal disorders. His world-class center provides a venue where doctors and their teams can come to learn from some of the finest and most knowledgeable clinicians. The concepts and implementation of study tracks will allow any participant to choose a course of study that best suits his or her practice. The center hosts numerous accredited classes throughout the year and provides the ultimate in modern treatment of patients suffering from the effects of occlusal instabilities. And now, let us join Dr. Gerber and guests at the Center for Occlusal Studies.
We're here at the Center for Occlusal Studies, where we offer courses by Orthodontic Studies. And I have a couple of doctors with us today that have been observing patient treatment, and they've recently become involved in orthodontics or a little bit longer involved in orthodontics. And they're going to give you a couple candid answers about why they got involved in orthodontics. And Ted, we'll let you go first. Why did you get involved in orthodontics as a general practitioner?
Well, I started investigating. My patients were always asking for different types of therapy, quick, non-invasive therapy. So I took a few courses that were helpful. But as I became certified in these other courses, I discovered that they were not evaluating the patients as much as they needed to be, and that's where I found Jay, and he's really led me to a terrific education, and I'm very comfortable in where I'm going to be going with braces.
Now, I know you've had a lot of courses and you've treated a lot of patients, and even after that, you still came to my office here to watch us treat patients like we do. What do you think, I know what it means to you, but what do you think it means especially to somebody that's just beginning to do orthodontics? How important is it them for them to take a course, not in a motel, but actually come to we have our classroom here, we have the clinical facility, which is part of our courses. How important is that?
There's a huge difference in seeing something on the screen and then working on it, typing on it, but coming where you can actually see it implemented on live patients, see how it's organized in your office. That's a huge thing, because if you're just beginning, if you've got 1 or 2 cases that you're starting, it's not an issue, but as you progress, you have 10, 15, 20 cases going, it begins to be an impact on your practice, and you need to know how to incorporate all of that, streamline your practice. I think it's invaluable.
Well, good. Gentlemen, thank you very much. I appreciate your comments.
Dr. Gerber is the Curriculum and Clinical Director of the Center, and he is a certified senior instructor of the IAO. He is a member of the American Dental Association and the Academy of General Dentistry, holds a fellowship in the International College of Craniomandibular Orthopedics, and is board certified by the American Academy of Pain Management. And now, let us join Dr. Gerber during a study track at the Center for Occlusal Studies.
Debbie had bilateral joint pain, and she went through extensive treatment with a neuromuscular orthotic. She treated her with a computer, and she responded very positively to the treatment. And does anybody have any questions in regards to what type of treatment or how long her treatment lasts or anything of that nature?
How did you go into phase 2?
Well, we went into phase 2 with crowns and orthodontics. So what we couldn't correct fully with the orthodontics, we used crown and bridge.
Our overall mission is to provide the dental healthcare provider with a broad base of diagnostic and treatment skills in the areas of orthodontics and occlusion. We want the practitioner to be able to incorporate the learned skills into his or her practice to provide the public with the finest treatment possible.